Hello, this is Dr. B. So now we're going to talk about the hormonal IUDs. Hormonal IUDs are very effective. They work very well. They're all made with progestin, which is a synthetic progesterone. They typically have what we call a locally acting effect on contraceptive, meaning that they typically don't mess with or affect your overall systemic hormones. So that's the benefit. When initially you start on an IUD, it has to be inserted by a physician. The first 2 or 3 cycles, typically your cycles are not going to be a rhyme or reason to them. They're going to be a little bit erratic. Then over time, most of the time they either stop or they become very light. So a lot of women like that benefit because it thins down and protects endometrial lining from endometrial cancer. Now IUDs have been getting a lot of bad rap, but typically IUDs, the biggest concerns are when you're exposed to any kind of infection, especially sexually transmitted infections. They're a foreign body, so it can become like a focal point where it stays and it affects the uterus. You get abscess or infection or significant problems. That's typically only if you're exposed to those type of infections. They don't create an infection, they don't cause it, they just become a nidus where that infection can contact stays with. So if you do get one of those infections, you want to definitely take it out, make sure to treat it, and then look at other options down the road. But most times it's not a worry as long as you don't acquire any kind of infection like that. The IUDs are very good for cycle regulation, decreasing pain from cycles and also heavy cycles. So they work well there. They're one of the most effective birth control forms. Now, some people say, hey, they affect, I had a hard time losing weight or gaining weight or mood changes. The studies don't show that, but not everybody fits in the studies, and some women are a little more sensitive. And so some women come in and say, hey, this is how it affects me. So we take out the IUD. Most do great. Some still continue having those issues that they want to have removed over, but most times it's not a problem. The biggest issue with IUDs is when they're inserted, they're a foreign body, so your body's like, at first, like, what the heck? And it wants to either push it in or out. So typically, you do a check a month later. Do you have to? The standard is no, you don't have to. I typically do a quick check and ultrasound to make sure that the arms are in the right place, they haven't moved, because if it moves, it's less effective. And also, if it starts moving through the wall, why not take it out before we end up having to do surgery? So, is that very common? It's very uncommon. Most times they stay in place. I would say 99+% of the time they don't cause any issues or problems, and they work very well. And the nice thing is too, they don't have the systemic effects that the oral contraceptives do, where they affect, most time they don't affect neurological functioning, your hormones, your testosterone. They don't suppress ovulation. Your body still makes its natural hormones, and it's doing its thing. They don't affect the vestibule where you get painful intercourse, like we talked about on birth control. So, in my opinion, from watching women, it's a very effective form of birth control, and they work by thickening cervical mucus so the sperm don't get inside. And they also make the lining thin, so inhospitable to implantation. I hope this gives you a good idea of the effects of the hormones of IUDs versus oral contraceptives and how they work. And next time we'll talk about injections and implantables. And hope this helps. Have a good day. Thank you. Bye.